Hi, I'm Isabel Sawhill. I'm a senior fellow at the Brookings Institution and a member of the Fiscal Wake-Up Tour. The federal budget is on an unsustainable path. Right now, we have deficits that are virtually unprecedented. Now, that's as it should be because we're in a very depressed economy and government has become the spender of last resort. So the big deficits we're running right now are not the real problem. The real problem is the continuing red ink we will have as a result of the aging of the population and rising healthcare costs. Why are deficits so bad? First of all, if we don't address them, we're simply courting another economic crisis. Second, because we're borrowing so much of the money from foreigners, we're becoming dangerously dependent on other countries to keep our economy running. Third, we are passing on a mountain of debt to our children and grandchildren. And finally, we are paying an enormous amount of our taxes just for interest on the national debt. So, what should we do about this problem? First and foremost, I think, we need to address health care. Health care costs are a very large part of the problem, not just the health care that the government pays for in the Medicare and Medicaid programs, but also health care that's delivered through the private sector. The problem here is that it's easier said than done. When you remember that every health care cost is someone else's income, you realize how politically difficult it is to tackle this problem. Right now, most of the focus is on expanding coverage to those who don't have insurance. But if we were to do that without bringing costs under control, it would simply make our long-term deficit problem much worse. I see two possible solutions here. First of all, because healthcare is so valuable to most people and they really want it as advances in medical technology enable us to have a better quality of life, one could argue we should simply pay for something that we think is that valuable. We could do that with a brand new tax that was earmarked just to pay for health care. A value-added tax has been put forth as one source of revenue to pay for this, and we could dedicate that tax just to paying for health care. So that would tell the public that if they wanted all that health care, that was fine, but we would have to find a way to pay for it. And it would be clear to them as health care costs continued to escalate what it was costing them through this dedicated tax. A very different approach would be to say, let's just have a basic benefit for all Americans and don't allow them to have every last health care treatment that they might want. If they want more than what's in the basic package, they would be expected to pay for it themselves. This could be perfectly fair if we provided government subsidies to all of those who couldn't otherwise afford the basic plan. But it wouldn't be an open-ended system like the one we have now that is, I'm afraid, breaking the bank. Once we have taken care of health care, no easy matter, we should also tackle Social Security. In fact, many of us think we should tackle Social Security as soon as possible. The options for reforming Social Security are quite well known. They've been much debated, and so all that's lacking is the political will to enact them. What are they? The solutions here include increasing the retirement age, encouraging people to work longer, encouraging them to save more, possibly cutting the growth of benefits for the more affluent out in the future, and finally, perhaps raising payroll taxes. In the end, reforming health care and Social Security and getting other government expenditures under control won't be sufficient. We're also going to need new revenues. I say that because our demographics, our aging population demand it. Our politics demand it because we're not going to get a grand compromise until the package includes both revenues and spending. And I say it because the sheer size of the problem is so large that the math suggests we're going to need all the solutions we can get. My first choice for obtaining new revenues would be to use revenues to discourage something that we don't like. Examples could include greenhouse gas emissions, could include sugar-laden beverages, could include alcohol and tobacco, could include luxury goods or consumption more generally. I think those are all things that there's some consensus right now we should want to discourage, and we could collect some new revenue in the process. My second choice would be to eliminate or reduce many of the preferences and special deductions in current tax law. Everything from the mortgage interest deduction to preferences for the oil and gas industry. These deductions, loopholes, and special preferences cost us a bundle, something around $1 trillion every year. So if we could only reduce them by a quarter or a third or something along those lines, we could raise a lot of revenue. In addition, in the process, we would make the tax system less complicated, somewhat fairer, and much more economically efficient than it is right now. My third choice would be to raise tax rates, especially on the more affluent. This could include raising tax rates, income tax rates for the better off part of the population. It could include taxing dividends and capital gains more fully, and it could include taxing estates more fully. This is my third choice, not my first choice, but I think it makes good sense given that we've had such a big increase in income inequality in the U.S. in recent decades. Let me conclude by saying that none of this will be easy. In fact, just about everything I've just talked about is politically toxic. That's why the Fiscal Wake-Up Tour needs your help to send a message to those in Washington who need to make the tough choices. Only when the public is well informed and willing to act on that information will we get a solution to this problem. But without a solution to this fiscal challenge, we are going to have a nation that will be less strong, and we are going to leave a legacy to our children which all of us believe is morally wrong. Thanks for listening.